This is a very special invitation to our new Health Ministries Coordinator of New Jersey Conference to be acquainted with the President Cabinet of New Jersey Conference. This is a beautiful opportunity to have a person with education, the love and the passion to serve the church in this important area of the mission, health message. And it is my privilege to introduce to you this morning Opal DeLizer. She is a nurse with a cardiology specialist, and we are so happy to have her presenting to us this morning. Good morning, Opal.
Good morning.
We are so happy to have you in this meeting today, and I would like you to introduce yourself in the area you work, more specifically, and tell the people what you do in your life.
I am a nurse practitioner, and I work for Cooper Cardiology in Willingboro. I supervise stress tests, and I help with their cardiology consultation in the hospital.
We have a person with the knowledge to do the Ministry of Health in New Jersey Conference. We are blessed with people like her, and also I would like to introduce to you our Health Ministry Director, Pastor Tom Donnan. He is an important part of the team, and I would like to ask him to mention something about the ministry he loves.
Well, this is a very important and maybe even say imperative ministry that God has placed in His last day people, and we are blessed to have someone with such a vision as Opal. And what we are doing is attempting to open the opportunities for health ministries for the local churches so that they can engage in the community and provide services for the community in areas like diabetes screening, blood pressure screening, cholesterol screening, along with the New Start program, and as we are terming it, God's plan, and we'll be sharing more of that later. But we want to be able to train the folks in the local congregations to show them how simple it is to use the materials that are available to be able to minister through the health message to the communities that they are serving. And so we are looking forward to serving you in that fashion.
This is a real blessing we have in New Jersey to have a committed team, educated, ready to serve, because health message is simpler than some people believe. It's not a complicated situation. It's just to live according to the principles of the Bible, and you will be a healthy person serving the Lord. But now, let's enjoy the presentation of Opal DeLizer, our coordinator for health ministries in New Jersey Conference. Welcome.
In 1863, Ellen G. White had her first vision. And if you remember, at that time, the General Conference was just, I think it was just coming into being at that time. And God gave her her first vision. And why? Because if you remember, at that time, the church itself did not think about health and lifestyle issues. And so many of the pastors who were very overtaxed at that time, they were becoming ill, and they could not perform the duty that God wanted them to do. And so Ellen G. White, she was very burdened with this. And if you remember that her son, one of her sons, died at the age of 16 years old. And so she has this passion, but she didn't know where to go with it. And so God had given her her first vision, 1863. And from that vision, we see sanitarium, we see hospitals, we see clinics. We also see some of the healthy lifestyle institutions in our midst today. And if you think about health reform, in our churches, we have the extremists, isn't it, sometimes? And everything about meat and not eating meat, not eating eggs, not eating fish. Is this what health reform is all about? Much, much more than that. And if you followed me on your paper, it said it is about living a healthy life. It maintaining a healthy body, mind, and spirit as God's temple. And this is to be used to glorify God, actually. It should be a training ground for people to proclaim the gospel of Jesus Christ. It should be used to prepare people for missionary work. And if you remember even Jesus' time, what did Jesus do first? He healed. He healed the sick first. So this is like training people to go out there to learn how to heal the sick through the Holy Spirit. And then what comes next? The spiritual aspect of it will come next. And then they will appreciate it more, because then their pains will be gone. And then they don't have to think about their diabetic pills and their blood pressure pills and their cholesterol pills. They will feel much healthier, and their joints will not ache, and they'll be able to walk in the church and to perform their duties. Now, we talk about the 8 laws of health. God gave us 10 laws, the 10 commandments. But then in health there are 8 laws. Because if you remember with Adam and Eve and what he had said to them after he created Adam and Eve, and he gave them a diet. And why did he give them that diet? I mean, they were supposed to live forever. Did they need that? Exactly. Okay, so they did need that diet to live forever. But because of sin, everything had changed. And today we can see the effect of sin on our bodies. And then if you look at the 8 laws of health, I did it differently. Because the 8 laws of health, we can look at New Start. Now I'm going to look at God's plan for the church. And so I break it down that way. G is for godly trust. And O is for open air. And D is for daily exercise. S is for sunshine. P is for proper rest. L is for lots of water. A, always temperate, and N, nutrition. If you remember in New Start, nutrition is first. Now, and trust in God is last. Now I put trust in God as first. And that's where you guys come in, okay? Yes, that's where you come into this. Because you know what? Trust in God should be first. Because if we think about the health message, that's not what's going to take us to heaven. It prepares us so that we can be healthy to give the gospel to the world. But what's going to take us to heaven is the trust in God, the faith that we have in him. And so this year we're going to show people what is most important where the health message is concerned. For some reason, there was this 30-year-old police. And he was just sitting there waiting for the young people to come. And something tells me just to go to him and say, you know, why don't you utilize this? And he looked at me and said, no, I'm 30 years old. I said, try it. Why don't you check your cholesterol and your blood pressure? Well, he went, he checked his blood pressure, it was fine. And then he checked his cholesterol. It was 365. He almost had a heart attack right there. He could not believe it. He said, what? I was a time bomb. I said, oh yeah, sometimes, you know, not because you were young. And he was telling me that he did have health risks in his family risk factors of heart disease. And he said, well, tomorrow I'm going to my doctor and I have to take care of that. I said, you better take care of it now.